Welcome to the Tooth Talks. Today, let's learn about the management of tooth hypersensitivity in detail. Firstly, let's learn what is dentine hypersensitivity. So, dentine hypersensitivity is a sharp, short pain arising from the exposed dentine in response to any of the stimuli like thermal, chemical, tactile, or osmotic, and which cannot be ascribed to any other form of dental defect or pathology. Let's learn about mechanism of dentine sensitivity in brief. When a tooth with exposed dentine or dentinal tubules receives stimulus like thermal, mechanical or chemical, there is a mechanical disturbances created in the dentinal fluid. Thus, there is an increased rate of dentinal fluid flow, which further generates the action potential in intradental nerves, which is further carried to the brain. To learn about mechanism of dentine sensitivity in detail, you can visit our previous video on theories of dentine sensitivity. Let's learn about the treatment principle for dentine hypersensitivity. There are two principles. The first is plug the dentinal tubules preventing the fluid flow. So here the dentinal tubules which are open are plugged or occluded, thus preventing the fluid flow. There won't be any mechanical disturbances created inside the dentinal tubules. If this is not created, there won't be any nerve conduction. The second is desensitize the nerve to make it less responsive. So all the treatments are based on either of one of the principles. So let's begin with the treatment of dentine hypersensitivity. So the first are home care with dentifrices, which includes 10% strontium chloride, 5% potassium nitrite, and sodium monofluorophosphate. Let's discuss in-office treatment procedures, which includes burnishing of dentine, which is done using a toothpick or orange wood stick. It will form a smear layer which will partially occlude the dentinal tubules. Formation of insoluble precipitates to block the tubules are silver nitrate, zinc chloride, potassium ferrocyanide, formalin 40%, some oxalates like 6% ferric oxalate or 30% potassium oxalate, calcium compounds like dibasic calcium phosphate or calcium hydroxide, and fluoride compounds like sodium fluoride, stannous fluoride, or sodium silicofluoride. Other treatments like fluoride ionotophoresis, in which the ions are transferred into the body for therapeutic purposes, varnishes like copalite or duraflow, corticosteroids, tubule sealants like restorative resins, dentine bonding agents, and lasers. Patient education is very important. Patients should be taught correct toothbrushing technique. They should also be taught about importance of plaque control, and dietary counseling should also be done to create awareness among patients about eating too hot or too cold can act as stimulus. They should also avoid eating sugar or acidic food. Next is the natural process which contributes to desensitization, which includes formation of reparative dentine, dental sclerosis, calculus formation on surface of dentine. Thank you for watching the video. For more videos, please like, share and subscribe.